Colon cancer is one of the deadliest cancers in the world. But here's the terrifying truth. Many people already have symptoms long before they are diagnosed, and they completely ignore them. A little stomach discomfort, changes in bathroom habits, feeling tired every day. Most people blame stress, unhealthy food, or getting older. But sometimes these small warning signs are actually the body screaming for help. And the difference between finding colon cancer early or late can literally decide life or death. Today, we're going to talk about the earliest warning signs of colon cancer, what causes it, the solutions that may help reduce the risk, and why ignoring these symptoms could be one of the biggest mistakes a person can make. Stay until the end, because one of these signs might surprise you. Let's begin. And colon cancer begins in the large intestine, also known as the colon. In many cases, it starts as tiny growths called polyps. These polyps may seem harmless at first, but over time, some can slowly turn into cancer. The scary part is this: colon cancer often develops silently. Many people feel perfectly normal during the early stages. That's why understanding the warning signs is extremely important. One of the first symptoms people notice is a change in bowel habits. Maybe you suddenly start going to the bathroom much more often, or maybe constipation becomes a constant problem. Some people experience diarrhea for days or even weeks. Others feel like they can never completely empty their bowels. At first, these symptoms may seem small. Most people think it's something they ate. But when these changes continue for several weeks, it should never be ignored. So what's one possible solution? Improving digestive health is very important. Doctors often recommend increasing fiber intake because fiber helps support healthy bowel movements. Foods like fruits, vegetables, oats, beans, and whole grains may improve colon health naturally. Drinking enough water is also essential. Without proper hydration, digestion becomes slower and constipation may worsen. Regular physical activity can also help keep the digestive system functioning properly. But here's the important thing. Lifestyle improvements are helpful, but persistent symptoms still require medical attention. Never try to self-diagnose serious symptoms for too long. Another major warning sign is blood in the stool. This symptom scares many people, but unfortunately, some still ignore it. The blood may appear bright red. In other cases, the stool becomes very dark or black. This can happen because bleeding occurs somewhere inside the colon. Many people immediately assume it's hemorrhoids, and while hemorrhoids can cause bleeding, colon cancer can as well. That's why blood in the stool should always be checked by a medical professional. One of the most effective solutions is early screening. Doctors may perform stool tests, blood tests, or a colonoscopy. A colonoscopy allows doctors to examine the inside of the colon using a small camera. If polyps are discovered early, they can often be removed before they become cancerous. That's one reason why screening saves so many lives. Now let's talk about another symptom that many people overlook: abdominal pain and bloating. Some people experience constant cramps. Others feel pressure or gas pain almost every day. At first, the pain may come and go, but over time, it may become more frequent and more intense. This happens because abnormal growth inside the colon can partially block the intestine. As digestion slows down, pressure builds inside the stomach area. One solution that may help improve digestive health is reducing processed food intake. Highly processed meats, fast food, sugary foods, and low-fiber diets may increase colon cancer risk over time. Instead, doctors often recommend healthier foods rich in nutrients and antioxidants. Leafy greens, berries, nuts, fish, and foods high in natural fiber may help support overall colon health. But remember, pain that continues for weeks should never be ignored. Oh, especially when it appears together with other symptoms. Now, here's a symptom that surprises many people: extreme fatigue. Some individuals with colon cancer feel exhausted constantly. Even after sleeping for many hours, they still feel weak. Simple activities may suddenly become difficult. Walking upstairs may cause dizziness or shortness of breath. Why does this happen? In many cases, slow internal bleeding inside the colon causes iron deficiency anemia. The body slowly loses blood without the person noticing. As iron levels drop, oxygen delivery throughout the body decreases. This leads to weakness, fatigue, dizziness, and poor concentration. One possible solution is getting blood work done. Doctors can check iron levels and look for signs of anemia. Eating iron-rich foods may also help. Foods like spinach, lentils, beans, eggs, fish, and lean meats contain iron that supports healthy blood production. Vitamin C may also improve iron absorption. But treating fatigue alone is not enough. The real cause must always be identified. Now let's discuss unexplained weight loss. This is one of the most serious warning signs. If someone suddenly loses weight without dieting or exercising, the body may be fighting a serious illness. Cancer affects metabolism. It can reduce appetite and change how the body processes nutrients. Some people feel full very quickly after eating only a small amount of food. Others lose interest in eating completely. One important solution is early medical evaluation. Doctors may use scans, blood tests, and colon screenings to determine the cause. Maintaining good nutrition is also essential during recovery and treatment. The body needs enough protein, vitamins, minerals, and calories to stay strong. Another possible warning sign is thinner than normal stool. Some patients notice stool that looks narrow or pencil-like. This can happen when a tumor partially blocks the colon, changing the shape of the stool as it passes through. Many people ignore this symptom because it seems unimportant. But when it continues for several weeks, it should always be discussed with a doctor. Another symptom many patients describe is the constant feeling of needing to use the bathroom, even after they already went. This uncomfortable sensation may happen because something inside the colon interferes with normal bowel function. Now let's talk about who is at higher risk. Age is one of the biggest factors. The risk of colon cancer increases after age 45. However, doctors are now seeing more cases in younger adults than ever before. And this is extremely concerning. Many younger people ignore symptoms because they believe colon cancer only affects older adults. Unfortunately, that is no longer true. Family history also plays a major role. If parents, brothers, sisters, or close relatives had colon cancer or colon polyps, the risk may be higher. In these situations, doctors often recommend earlier screening. Lifestyle choices also matter. Smoking damages the body in many ways and may increase cancer risk. Heavy alcohol consumption can also contribute to long-term damage. Obesity and lack of exercise are additional risk factors. That's why maintaining a healthy weight and staying active are extremely important. Regular exercise helps digestion, reduces inflammation, improves circulation, and supports the immune system. Even daily walking may improve overall health. Now here's something important many people don't realize. Colon cancer is often preventable, and one of the most powerful weapons against it is early detection. Screening can find dangerous polyps before they become cancer. This is why colonoscopies save lives every single day. Many people avoid colon screenings because they feel embarrassed or afraid. But avoiding screening can be far more dangerous than the test itself. Doctors usually recommend routine colon cancer screening starting around age 45. However, individuals with family history or symptoms may need testing even earlier. Now let's discuss possible treatments and solutions if colon cancer is discovered. Treatment depends on how early the cancer is found. In early stages, surgery may successfully remove the cancer completely. In more advanced stages, doctors may combine surgery with chemotherapy or radiation therapy. Targeted therapies and modern treatments are also improving survival rates every year. But once again, early detection makes the biggest difference. When colon cancer is discovered early, survival rates can be very high. That's why awareness matters so much. Now let's quickly review the major warning signs again. Persistent constipation or diarrhea, blood in the stool, abdominal pain or bloating, extreme fatigue, unexplained weight loss, thin or narrow stool, and feeling like the bowel never completely empties. If any of these symptoms continue for several weeks, it's important to seek medical advice. Do not wait for severe pain. Many early-stage cancers cause only mild symptoms at first, and sometimes there may be no symptoms at all. That's exactly why regular screening is so important. Now let's talk about prevention. A healthy lifestyle may help reduce the risk of colon cancer significantly. Eating more natural foods is extremely important. Fresh vegetables, fruits, whole grains, and fiber-rich foods support digestive health. Reducing processed meats and fast food may also help lower risk. Drinking enough water every day supports healthy digestion and bowel movements. Exercise is another powerful tool. Regular movement helps improve metabolism and supports the immune system. Avoiding smoking and limiting alcohol may also protect long-term health. Managing stress and getting enough sleep are important as well. The body heals and repairs itself during sleep. Poor sleep habits may negatively affect overall health over time. But perhaps the most important thing is this: listen to your body. Small symptoms are sometimes early warnings of much bigger problems. Ignoring them will not make them disappear. Early action can save lives. Colon cancer is a serious disease, but many cases are treatable when detected early. Knowledge, awareness, and regular screening can make an enormous difference. And remember this: your body often gives warnings long before a disease becomes dangerous. The key is paying attention before it's too late. If you found this video helpful, make sure to like the video and subscribe for more health and medical content explained in a simple and easy way. Take care of yourself, stay healthy, and we'll see you in the next video.